GOP, Dems offer compromise to reduce drug costs for seniors. Washington. Two senior senators, a Republican and a Democrat, unveiled compromise legislation Tuesday to reduce prescription drug costs for millions of Medicare recipients, while saving money for federal and state health care programs serving seniors and low-income people. Iowa Republican Charles Grassley and Oregon Democrat Ron Wyden said the bill would for the first time limit drug uptake for people with Medicare Part B prescription plans by capping patients' out-of-pocket costs at $100 a year starting in 2022. They're hoping to have it ready soon for votes on the Senate floor. The legislation would also require drug makers to pay a price hike penalty to Medicare if the cost of their medications goes up faster than inflation. Drugs purchased through the pharmacy as well as those administered in doctors' offices would be covered by the new inflation rebate. Political compromises over health care are rare these days. The bill reflects efforts by lawmakers of both parties to move beyond the rancorous debates over the Obama-era Affordable Care Act and focus on ways to lower costs for people with health insurance. Separate legislation to address surprise medical bills has already cleared the Senate Health, Education, Labor and Pensions Committee. The senators said preliminary estimates from the Congressional Budget Office showed that the Medicare program would save billions over 10 years, while seniors would save billions in out-of-pocket costs over the same period, and billions from slightly lower premiums. The government would save billions from projected Medicaid costs. CBO also projected that Medicare's inflation rebate would have ripple effects, leading to prescription drug savings for private insurance plans sponsored by employers or purchased directly by consumers. The senators announced a Thursday vote on the package by the Finance Committee, which oversees Medicare and Medicaid. Grassley is the panel's chairman, while Wyden serves as the senior Democrat. Pharmaceutical companies play a vital role in creating new and innovative medicines that save and improve the quality of millions of Americans' lives, but that doesn't help Americans who can't afford them, Grassley and Wyden said in a joint statement. This legislation shows that no industry is above accountability. The White House encouraged the Senate negotiations, and spokesman Jafir said the Trump administration stands ready to work with senators to ensure this proposal moves forward and advances the president's priority of lowering drug prices. Democrats controlling the House want to go farther by granting Medicare legal authority to directly negotiate prices with pharmaceutical companies. Direct negotiations are seen as a non-starter in the Republican-controlled Senate, but the bill's drug price inflation penalty may have find support among Democrats in the House. Grassley's office said the bill will force drug makers and insurers to take greater responsibility for keeping Medicare prescription prices in line, instead of foisting increases on taxpayers and beneficiaries. The lack of a cap on out-of-pocket costs for Medicare's popular prescription benefit has left some beneficiaries with bills rivaling a mortgage payment. That's because with Medicare's current protection for catastrophic costs, patients taking very expensive drugs are still responsible for 5% of the cost, with no dollar limit on what they pay. For example, 5% of a drug that costs $000 a year works out to $000. Thank you for watching. Please subscribe.